Welcome to episode 45 of the Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're focusing on the baroreflex, which is one of the most essential mechanisms for maintaining stable blood pressure. This reflex allows for rapid adjustments in heart rate, stroke volume, and vascular resistance to keep blood pressure within a normal range. By the end of this episode, you'll understand how baroreceptors detect pressure changes, how the autonomic nervous system responds, and why the baroreflex is critical for cardiovascular homeostasis. So let's dive right in. The baroreflex is also known as the baroreceptor reflex, and it's a negative feedback loop that helps regulate short-term blood pressure changes. This reflex responds to sudden increases or decreases in arterial pressure by adjusting heart rate and vascular tone. At the core of this reflex are baroreceptors, which are specialized, stretch-sensitive receptors that are primarily located in the carotid sinus, which is near the bifurcation of the common carotid artery, which monitors blood flow to the brain, as well as the aortic arch, which monitors systemic arterial pressure. These baroreceptors continuously monitor arterial pressure and send signals to the medulla oblongata, which is the cardiovascular control center in the brainstem. The baroreceptors detect changes in arterial stretch and adjust firing rates accordingly. Increased blood pressure, also known as a hypertension response, occurs, or when this occurs, the baroreceptors have increased stretch, which increases their firing rate. Signals are sent via the glossal pharyngeal nerve, which is cranial nerve 9, and the vagus nerve, which is cranial nerve 10, to the medulla oblongata. The medulla activates the parasympathetic nervous system and inhibits the sympathetic nervous system. This results in decreased heart rate, or bradycardia, via vagus nerve inhibition of the SA node. This also reduces cardiac output due to that lower stroke volume. Vasodilation occurs, which decreases total peripheral resistance, and so the overall effect is that blood pressure is lowered. Then there's the decreased blood pressure or hypotension response. So in this case, there is reduced stretch of baroreceptors, which leads to them having a lower firing rate. The medulla activates the sympathetic nervous system and reduces the influence of the parasympathetic nervous system. As a result, heart rate increases via sympathetic stimulation of the SA node, and cardiac output increases by boosting stroke volume as well. Vasoconstriction also occurs, which increases total peripheral resistance to restore blood pressure. As a result, blood pressure increases. Now, it's important to remember the baroreflex is a short-term mechanism that provides rapid compensation for blood pressure fluctuations, such as when you stand up suddenly. However, it does not regulate long-term blood pressure, as the kidneys primarily control long-term blood pressure via the renin-angiotensin-aldosterone system, also known as ROS. Now, there is some clinical relevance to the baroreflex. We can have something called orthostatic hypotension. This is a condition where the baroreflex fails to compensate quickly enough for a drop in blood pressure upon standing, which causes dizziness or fainting. Then there's chronic hypertension. In cases of long-term high blood pressure, the baroreceptors actually reset to a higher threshold, making them less sensitive to increases in pressure. In essence, they become okay having high blood pressure. Then there's heart failure. Baroreceptor function may be impaired, which leads to inadequate cardiovascular compensation. So let's summarize with 4 key takeaways. First, the baroreflex is a short-term regulatory system that adjusts heart rate and vessel tone to maintain stable blood pressure. Increasing blood pressure activates the parasympathetic nervous system, slowing the heart and causing vasodilation. Decreasing blood pressure activates the sympathetic nervous system, which increases heart rate and causes vasoconstriction. The baroreflex does not regulate long-term blood pressure. That's controlled by the kidneys, and we'll get into that in a future episode. And so with that, we're done for episode 45 of the Pulse of Physiology. I hope this episode has clarified how the baroreflex maintains cardiovascular stability. And so join me next time for episode 46, where we'll discuss the skeletal muscle and respiratory pumps and their role in venous return. Until then, keep questioning, keep exploring, and stay curious.